Hi everyone, welcome back to my YouTube channel, and today we are going to talk about nose development. So let's start our topic with introduction. Nose develop from frontonasal and maxillary prominences during early embryogenesis. Its formation involves development of nasal placodes, nasal pits and nasal sacs, which eventually form the external nose, nasal cavity and olfactory epithelium. Proper fusion of these structures is essential for normal facial development, and failure can result in congenital anomalies like cleft lip or choanal atresia. Embryonic origin of the nasal cavity. It has ectodermal origin that forms the epithelium of nasal cavity and olfactory epithelium. It also has mesodermal and neural crest cells that forms cartilage, bones and connective tissue of the nose. And it also has contribution from ectodermal placodes that form olfactory receptor cells. Timeline of development. It starts with week 4 when nasal placodes appear as bilateral thickening of surface ectoderm on the frontonasal prominence. Then there is week 5 in which nasal placodes invaginate to form nasal pits that are surrounded by medial and lateral nasal prominences. Then there is week 6 in which nasal pits deepen to form nasal sacs, and these nasal sacs are separated from the oral cavity by oronasal membrane. And fusion of maxillary prominence with medial nasal prominence form the upper lip during 6th week. Then there is 7th week in which oronasal membrane ruptures, creating the primitive choanae that are nasal opening into primitive oral cavity. And then there is formation of primary palate that begins from intermaxillary segment. Then there is week 8 to 10 in which nasal cavity elongate posteriorly as the palate develops, thus separating the nasal and oral cavities. Then there is secondary palate formation that is further separates the nasal and oral cavity. Then there is week 10 to 12 in which there is differentiation of nasal conchae and paranasal sinus primordia begins. Olfactory epithelium develop from ectoderm of nasal placodes during week 10 to 12. Formation of structures related to nose. First is external nose. It is formed by fusion of medial nasal prominences that form the bridge of nose and philtrum, and also by lateral nasal prominences that form the sides of nose. Maxillary prominences form the lateral part of upper lip and cheek. Then there is nasal septum that develops from a downward growth of frontonasal prominence. It joins the developing palate to separate the nasal cavity into right and left chamber. Then there are nasal cavities that are basically nasal sacs that deepen and expand posteriorly, thus forming the nasal cavity. Posterior choanae open into the nasopharynx after secondary palate formation. Then there are nasal conchae that are outgrowth from the lateral wall of nasal cavity that develop into superior concha, middle concha and inferior concha. Then there are paranasal sinuses that develop as diverticula from nasal cavity walls during late fetal life and expand postnatally. Then there is olfactory epithelium that is derived from ectoderm of nasal placodes, and olfactory receptor neurons remain in direct contact with the environment, thus forming the olfactory nerves, that is first cranial nerve. Clinical significance of the nose development. First is choanal atresia, that is failure or breakdown of oronasal membrane that leads to blocked choanae, and it presents with difficulty breathing in newborns. Second is cleft lip and palate. It occurs when there is failure of fusion between medial nasal and maxillary prominences that cause cleft lip. It can occur when there is failure of palatal shelf to fuse that causes cleft palate. And the second significance is nasal septal deviation. It is abnormal growth of nasal septum during development. And then fourth significance is agenesis of paranasal sinuses, that is real failure of sinus development. Conclusion of this lecture video. Development of nose is complex process involving ectoderm, mesoderm and neural crest cells. Precise fusion of facial prominences and breakdown of membranes is essential for forming functional nasal passages. Disruption in this process lead to congenital anomalies like choanal atresia, cleft lip and palate. And this was all about nose development. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.